Hey everyone, welcome back to my channel. Today I will be discussing asthma that will include an NCLEX review. My name is Christina, nurse practitioner. Let's get started. Asthma is a chronic inflammatory disorder that can cause inflammation within the airways of your lungs at varying levels of severity, making it difficult for the affected individual to breathe. So within your lungs, you have your trachea, referred to as the windpipe, that travels down and separates into your right and left side of your lungs. Your right lung has 3 lobes and your left lung has 2 lobes. Within that, you have your bronchioles that become your bronchi. Within the bronchi, it contains your alveoli that looks like small little grapes. This is where gas exchange occurs. However, when it is interrupted from inflammation because of asthma, gas exchange is impaired. This can occur from an elemental exposure, such as, for example, smoke irritant, that creates that inflammation. So carbon dioxide is retained within the alveoli and can result in respiratory acidosis. So some other asthma triggers can include environmental changes such as mold, dust, perfumes, pollen, animal dander, and cockroaches. So having asthma can be worsened with like sinus infections, GERD, stress, exercise induced as well. Medications that are contraindicated with patients that have asthma include beta blockers ending in lols, also aspirin and any NSAIDs. So now we know what those triggers are, but how does it mediate a response? So IgE are your mast cells. These are produced in excess. When a person comes into contact with an allergen, it creates a type 1 hypersensitivity reaction that causes smooth muscle contraction. Hence, symptoms occur that would include mucus secretions, chest tightness, sometimes a cough, and wheezing. So take a listen to this. So some of those triggers can be categorized into acute versus late response. So I always utilize the National Asthma Education and Prevention Program for updates on asthma management. So take a look at this chart. This is a 6-step approach on managing asthma in youths greater than 12 years of age and adults, which I will refer to by the kind of asthma, which can be intermittent asthma or persistent asthma for management of symptoms. However, the key question to ask your patient is, how often are you having the symptoms? So here are the 3 categories of severity of asthma, which you also need to know for NCLEX. Intermittent asthma, you may have symptoms less than 2 times per week. So this is your patient that will have a rescue inhaler referred to as SABA, which is a short-acting beta antagonist, which helps relax the smooth muscles. It is suggested if you use your SABA inhaler more than 2 times per week, you have to use a step-up approach and add on a low-dose inhaled steroid referred to as step 1. Then you have your mild persistent asthma. This is when the patient has symptoms more than twice a week, but less than once daily. This patient should have a rescue inhaler referred to as SABA and a low or medium dose inhaler that would place them in the step 2 or 3 approach. Moving on to moderate persistent asthma. This would include the patient that has symptoms daily but not all day. Their med regimen would consist of a medium dose inhaler plus a LABA, which is a long-acting beta adrenoreceptor agonist. It helps relax the smooth muscle for longer periods of time. LABAs would include like fluticasone, Pulmicort, or Asthma-Nex, with their rescue inhaler known as SABA. So for NCLEX, we will want you to be familiar with the difference between COPD COPD versus asthma. And I want to emphasize the difference among these two pulmonary disorders, which is COPD has symptoms that are slowly progressive, and asthma has an onset that typically is early in life, and symptoms may vary from day to day. So here are some assessment findings, and you can remember those symptoms by the following acronym that I made up, which will probably be on NCLEX. 3 P's, 3 D's, what? As WHUTT. The 3 P's is your prolonged exhalation because of CO2 retention. And then your pulsus paradoxus occurs when you have a drop in blood pressure. Usually it's like 10 millimeters of mercury with each breath in. Your pulmonary function test is used to measure the peak flow, and then you always want to review the patient's trends. And then your 3 Ds include diaphoresis, decreased oxygen levels, which is a late finding, and diminished or absent lung sounds. And then the what? The WHUTT. So W is wheezing or crackles. The H is hyperresonance. The U is for using those accessory muscles to breathe. And then the T is for tachypnea. The other T is for tachycardia, and it could be from your rescue inhaler. And then it also includes cyanosis and restlessness. And as a nurse, you want to monitor vital signs and review those trends. And it will also include your oxygen saturation, monitor peak flow trends like we just said, and maybe help assist with breathing treatments for symptom relief, monitor their symptoms for worsening condition, and escalate the care as needed because you're their advocate. You know what they need. Educate the patient about the use of the asthma zones, develop an action plan with them so when they're home, they know how to manage their symptoms and they have the tools and the resources. And last, the key point upon discharge, you always want to make sure they have enough medications, especially the rescue inhaler, including making sure they also have follow-up appointments with their specialists so then that way they can manage the care for their asthma. Again, thank you so much for watching. Be sure to subscribe for upcoming notifications. Take care.